I was asked to talk about barriers and enablers for a member state. I don't dare to be the voice of a member state, so I will just give my our personal opinion from TIC BIOMED. So I'm Jorge Gonzales. I'm the director of TIC BIOMED. We are an association, a business association located in Spain, in Murcia. We specialize in demand-driven innovation, public procurement, exploitation, dissemination, and communication. We are mainly funded by European projects. So, well, I guess that everybody here in this telco is aware of this. So I'm going to repeat, or I'm going to address things that you already know and you already agree, but I just want to make the point, okay? And this is very much related to what Albert was mentioning before. So I guess that everybody that has been involved in innovation projects, especially if they're publicly funded, has suffered or has seen this reality. Okay, we do a lot of innovation. Most of the innovation is successful, delivers results, and then it is not adopted. It goes to the valley of death. Okay, so then it has no impact. And then from time to time they say, oh, come on, but it has some impact. There is a follow-up. There is a publication. Listen, we are taking public money. We're taking everybody's time. We could do much better than just a small impact. We all write exploitation plans. We promise the moon, and then we deliver very, very little because among other things, there is no follow-up, okay? And this is such a waste that now in Europe, in Brussels, was mentioned that I moved in Brussels for some time. When you talk with the European Commission, it's all about competitiveness. I don't need to explain you what is the geopolitical situation right now, okay? And it's a waste in money, it's a waste in opportunity, it's a huge opportunity cost, and also in the illusion. This is really very counterproductive, not only because it kills the culture of innovation. What has happened with that is that we have worked with doctors, nurses, that they were very passionate about what they were doing, how they were contributing to the innovation project. And then we get results, they are very happy, and they expect that this is going to be deployed in their day-to-day, and nothing happens. So what it happens then is that they tell us, don't ever call me again, because with research, I can publish, that goes to my curriculum, but with innovation, I get nothing. I spend my time, I spend time that is either taken out of my work or my family or my leisure, and then I'm even worse than when I started, okay? Because now I know that there is a solution, but I don't get it. So also, for the company, I'm talking here mainly when there is a healthcare organization and a company working together. Okay, this is going to be kind of my frame. There are other frames, but we do a lot of collaborative projects, and that's what we see. Now, startups, SMEs working with healthcare organizations, if there are successful results, and then the healthcare organization that maybe put the problem on the table in the first place, they don't adopt, that's a killer for the SME. Because how can they go to another healthcare organization and say, we have a great solution, we did it with that other hospital, but that other hospital didn't adopt it. All the credibility goes away, okay? And then it's very difficult for them to commercialize. And also think about the opportunity cost. All these resources, doctors, nurses, innovation managers, they could have been doing another thing that would be much more productive. So it's really, really very counterproductive, such a big waste that we don't adopt innovation, that for us, because we are all in this innovation theater where our goal is doing projects, and what's the next project, okay? So what we say is that we need to stop and we need to think why we do innovation in the first place. We need to think how to improve innovation. We need to innovate on the innovation processes and tools that we have. We call that meta innovation, okay? We need to understand that innovation is not an end by itself. It is a means to an end, okay? For some people, it's a way of life. It's a way to pay mortgages. okay? But we should never forget why we do things, okay? Because otherwise, when you look back and say, what have I achieved? You know, I now start to get a lot of gray hair. When I look back, what is going to be my legacy? What have I achieved? What are my results? And then I look back and I see most of the results, they have never been deployed. So what's the meaning of all this whole thing? So what do we know? We know to search for calls. We know how to find partners, write proposals, manage projects, ask for amendments, submit deliverables, promise exploitation. We know all what is needed to make an innovation project, okay? Now, what we don't know systemically, okay? Maybe it happens in some projects, good for them. But I'm talking about systemically, as a system, as a process that goes on and on. We don't know how to move from TRL 7 to 9, okay? Because most grants finishing at 7, 8, they tell us they cannot fund TRL 9. Okay, now it's planned to be changed somehow, but in principle, they tell us you need to stop at TRL 8, 7 or 8 maximum. So how are we going to move from that TRL to TRL 9? Okay, how we are going to move from TRL 9 to adoption? Because one thing is that the solution is ready, another thing is that you adopt it. How do we scale? That was mentioned by Raymond. How do we create a commitment to deployment? Meaning that if we start something, if we start an innovation project in a healthcare organization, how much committed we are that we are going to adopt it if there are successful results. This is what we don't know. And this is our challenge as an ecosystem for all of us. And I have to say, it is not only healthcare organizations, it is also SMEs, companies, that you will be crazy. How come a company that has developed a product, they don't commercialize it? It happens because some companies, they use innovation funds just to make, to fund themselves, okay? Also, they have made this a way of living because for them it's easier to get the grants than to go to the market and sell. Okay, so it's not only, I'm not blaming all with the demand. It's also the supply side that is also perverted, but this innovation theater we live on. So our point is that making pilots is easy, adoption is not. So we should know that at this time that if we finish at TRL 6, 7, 8, if the results require a certification, because even if the solution is in TRL 9, some of them, they need the medical device certification. If we have no prior commitment from top management from the beginning, okay? If everything depends on one person, one healthcare professional, usually, that is very motivated, but it doesn't bring the whole team. If we don't involve people that is going to be critical for the adoption, like management, legal, procurement, IT, if we think that, okay, there will be another funding round after we finish the project, if we don't have a reserve allocation, we don't have a governance. If we start the project, say, okay, let's see first what happens. When we get to that river, we will cross that bridge. Then we know that most likely the results are going to go to the valley of death. Now, this is the bad side of the story. I want to give you some hints. Okay, what can we do? Because I believe that top-down, like Ramon was mentioning, is absolutely necessary. But what I want to bring here is the bottom-up. I appeal for the personal responsibility of everybody involved in doing innovation, not only, say, the politicians. It's very easy to blame the guys that, I don't know, they are at the top, they are even in, national in Madrid or in other places, okay, the ones at the national level or even at the European level. No. For us, it's more the individual, all the guys that working in the project that has the major responsibility to make this happen, okay? Enabled by the people in the policy level, etc., etc. But if we don't have personal responsibility, this will not happen. So I'm presenting here the typical demand-driven innovation. As I said, we work a lot with demand-driven, pre-commercial procurement, And I'm going to use this process as an example of how things could be done. Okay, this is likely the process where that demand-driven starts. We start with an identification of the need in the healthcare organization. We do an open market consultation. We talk with the supply side, what can we improve? And from the initial unmet need, we define a challenge. We publish asking for a call for suppliers. We select the partner. We do the co-creation. We do the evaluation. And again, most of the time, there are successful results. The innovation works, okay, at least in our experience. And then they tell us, the funders say, oh, okay, now it's up to you, the adoption. Okay, and then most of the times the innovation unit says, okay, I've done my work. My work was to do this part. Now I hand over to the procurement department to put the budget on the table. I leave it to legal to see that everything works, to IT, if there is a digital solution, to the other clinical colleagues. It's not my problem from the innovation unit, okay? What is my next pilot? What is my next project? Because that's my job. That's what I care. And by the way, I also have to pay my mortgage and the mortgage of everybody around me, okay? So this is what happened. And then what we see is that when adoption is left to their own devices, it doesn't happen most of the time. Okay, so what do we say? What we say is that if we want adoption, we need anticipation. Okay, we cannot leave adoption till the very end. We need to start thinking of adoption from minute number one. Okay, so that means that from the very beginning, we have to seek for champion support. Sorry. So we need to have someone at the top that says, yes, this is very strategic. This is very critical. I like it. I'm going to help you. You will, guys, be on the trenches. You will do the innovation, but I will be ready if there are any obstacles to movement. We have to look for the engagement of IT, legal, procurement, all those stakeholders that are going to be critical for adoption later on. For me, if you have to remember one word of my presentation is commitment. Commitment from everybody, especially from the top, saying, if this works, this is going to be adapted no matter what, okay? Because otherwise, it will not happen. It doesn't happen. We need commitment from the beginning, especially for the guys at the top management. Sometimes we have been in projects that the top management didn't know that that project has been carried out. And then they come and say, oh, very nice, but this is not a priority. And I don't have budget, no resources to implement it. How come? How come? Now, for example, then it's a question also on engaging these stakeholders, decision makers, for example, in being part of the jury when we select the partner. Something very important. At some point of time during the pilot, during the co-creation, you can be very certain that it's going to work, okay? But the thing is that if the project ends in April, and especially, well, most of the times the healthcare organizations are public organizations or big organizations, they go by annual budgets. If you don't do a budget provision the year before, in April, you will get the answer, okay, this is very nice, but this is not in the budget. Come back in November or December, and we will make it for next year. Well, chances are it will not happen, okay? And then we need to do something. Someone has to take over on the tender, on create a tender, on create the paperwork, so to say, allocate the budget and so on and so forth. We call them adoption touch points. This is just examples. There are many of them, but you get the idea. Okay. Again, for adoption, you need anticipation. That is what is critical. This is in more detail, okay? And I could be talking about this about hours because for me, this is kind of it frustrated me as in BIOMED that we have created policy papers, we have created a lot of deliveries. That's why I went to Brussels. But just to give you some glimpse, okay? Apart from the adoption touch points, well, I have mentioned a lot of this, okay, but now here you have it because just also I wanted to put it for the people that was not in the telco but could access the slides, okay. So difficult conversations. Most of the times when you do co-creation, you get between a healthcare and a company, you get a good relationship. But this, say, between the innovation units, you don't engage with the commercial guys or the top decision makers. And you just leave questions as price, willingness to end, to the end, to the other guys. The innovation guys, they don't deal with money. They just deal with innovation, with technology, that with end users to make it work smoothly. They don't care, or they don't feel it is responsibility to ask about price. For example, in pre-commercial procurements we have participated, price is not a criteria for selection, and it's not something that is asked. You just say, okay, we just want excellence. And then what happens is that the project delivers a Ferrari, and then you realize that you can only pay for a Volkswagen Golf. And then there is no deal. And then the company goes, but why did you ask me for a Ferrari when you only can afford a Golf? Okay, so we come to what I mentioned before. It's such a waste and such a frustration because we don't put the hard questions on the table early on. Governance. Governance is how we are going to structure the transition between the end of the innovation project and the actual adoption, procurement, deployment, whatever you want to call it. Okay. It is not the role of the innovation unit guy to do the deployment, at least in our opinion. They don't have the skills, the resources, the power, the authority to do so. It has to be someone else that is in the day-to-day, in the productive. Okay. So the question is very critically is like, say that the innovation pilot works well. What is the governance? Who is going to do what, when, which resources? And here the key question is the who. Because if you know that the who doesn't have the authority, the connections, the access to the budget, it goes to the valley of death. Okay, so governance is critical in order to cross this chasm between end of project and then production. Now, culture. Culture is critical. You know that this sentence, this book, culture, it's strategy for breakfast. Okay, unless we create a culture that says, if we start something, we have to finish. Otherwise, we don't start it. If we don't create that systemic mindset, this is going, flower of a day, but nothing else. And then, and here the seventh one is more related what it was mentioned before in terms of policy making. And me personally, I think that we need to, when I was talking about this meta innovation, especially in the case of demand-driven innovation, pre-commercial procurement is an instrument, but not for everything. We should have other instruments that promote this collaboration between offer and demand, but in a leaner, faster, cheaper way. Okay, again, I could talk about this for all the time, but I don't know even how. And please stop me if I'm taking too much time. Okay, but this is not the point. But just to say that we should also invest in thinking of new instruments. Luckily, I think that the European Commission now in FP10 is thinking about that. But let's see.
Jorge, you're good in terms of time, so no worries. Okay. You have like a couple or 3 more minutes if you have some slides to continue.
This is my latest slide. As I say, I could talk about this for hours, but here in the screen you can go to our webpage. We have this initiative that is called Impactful Innovation. So basically, we have reflected on why this lack of adoption happens and what could be done. I've given you some glimpses. In this page, you can find more detailed information with including policy papers we have created. You have there the URL, and of course, I will be very happy to have a one-to-one conversation about this. Okay, because for us this is really important.